Public Health Progression. This is officially our first episode, and I'm sitting here with our very beautiful guest, June. Let June introduce herself first.
Thank you again, Natty. Justin, which is
Natty.
Okay, right. I mean the name that I'm used to, right? Yeah. So my name is June. I am a nurse by profession. A medical researcher. Very passionate about digital health, and I'm equally in the digital health space as well as telecommunication. Um, as a researcher, I've mostly dealt with women, adolescents, and children. That's where I do have a special um, interest in. Yeah. So yeah.
So June is here today to educate us on a highly ignored topic. Probably not ignored, but you have to Google or go to the hospital for you to get more knowledge on it. Family planning. Family planning has so many misconceptions and a lot of cultural beliefs. And I thought we should demystify these rumors.
Yes, we will. By the end of the day, we will do all that. Yes.
Yeah, but first, let's understand what's family planning.
I mean, just by mentioning family planning, it is self-explanatory. The whole idea of family planning is to help you as an individual or you as a woman and your partner to actually plan your families, right?
Yeah.
To also help you in spacing the birth spacing for your kids, because it is essential to ensure that your kid is getting all the necessary help. And then also family planning, they usually say helps in prevention of some STIs, and in this sense we're talking about methods such as condoms.
Yeah.
So family planning in itself, it's self-explanatory.
Yeah. So what are the different types of family planning and how do they work?
Okay, so there are different types of family planning. We do have the non-hormonal family planning methods. We do have the hormonal family planning methods. So when you're looking at the non-hormonal methods, we do have the barrier methods, e.g. The condom. We do have lactational amenorrhea, which is mostly applicable in women who have given birth. They're strictly breastfeeding. They have not seen their periods, and it's usually, especially in the first 6 weeks of life, that is mostly applicable. But remember, it also has those three things to look at before you go to that. Apart from that, we do have the fertility awareness methods. This is where we look at the vaginal mucus. You would look at that, and also we do have calendar methods where you're counting your days and you're aware how your cycle is. And then we do have the IUCD. So those are non-hormonal.
Yes.
So for the hormonal methods, we do have also some IUCDs that are hormonal. We do have the injectable, with the most common method known in our society is the Depo-Provera. We do have the implants they usually put on the hand. We do have the Jadel that goes up to 5 years, which contains 2 rods. And then we have the Implanon, which is a family planning method that goes up to 3 years, and it has 1 rod. And then apart from that, we do have the patch, although the patch I've not really seen it being used mostly in the public hospitals. And then we do have the pills. And then the pills, apart from the pills, we also have the hormonal ring. Yeah.
So are there any pros and cons to the hormonal methods? And are the hormonal methods and non-hormonal methods, are they both, what do I say? Are the non-hormonal methods better than the hormonal methods?
I wouldn't put it that the non-hormonal methods are better than hormonal methods. Remember, women react differently to these methods.
Yeah.
Right? Also, another thing to add, for non-hormonal methods, they might be the best, especially if Maybe a woman has an underlying condition such as high blood pressure. So you see, with that, we will not really look much into it. But now for hormonal methods, we have to look at the medical eligibility criteria just to ensure that we're giving you a method that is safe for you.
Yeah.
Yes.
So those conditions that affect the choice of a family planning method, what are they?
So, well, generally, we will look at particular methods. With the medical eligibility criteria, they're usually categorized into 4 categories. So number 1, it's a method that you're able to use freely without any restrictions. With the second one, you have to use with care. And this is where we look at the advantages. Are they outweighing the risks? Then you'll go for it. And then the third one, you do not use that particular method unless there's no any other suitable method is available. But then again, with that, we have to ensure that there's close monitoring. And then we do have particular methods where we will not use them at all costs. So yeah, those are the things we look at. So yeah. And then I think something else that you probably asked me and I've not responded to are what are some of these conditions we are looking at when we're putting into consideration an FP method. So we do look at underlying conditions such as DVT, DVT or pulmonary embolism. We do have breast cancer. We have to look at that. We also look at viral hepatitis. Apart from that, we also look at the malignancies in the body. And then apart from that, we'll also look at medications. Which type of medications are you using? Are you on any TB therapy? Especially for a person who's using rifampicin or rifabutin. And then are you using any anticonvulsant medication? And then socially, we'll also look at are you smoking? Are you also breastfeeding? Yeah, so these are among some of the conditions we look at before we consider.
How does weight as a condition affect your choice of method, of family planning method?
I mean, when we're talking of weight, we'll talk about probably an obese person, right?
Yeah.
We're talking about obesity. Well, with weight, we have to ensure that that is also a consideration we look at, because some of these methods, we might have an impact, an adverse effect on your body. So let's say for some women, it might cause them to add more weight. So we don't want to put, to actually, instead of helping you as an individual, giving you something that is of use, but then again, we're creating more problems. So with that is why before any FP method, there's some parameters we have to look at. We have to look at your weight. We have to look at, we also require a pregnancy test so that we don't give you a method when you've already conceived.
Pregnant.
Yeah, it won't make sense.
You'll assume the method, the family planning method backfired or,
But in real sense, it's never the case. That's why you'll find some women talking about, I do not appreciate this type of family planning because I actually got pregnant. Although, yes, there's some methods up to 99% effective, but you might fall in the 1%
where you get pregnant with
while
it.
on that method. Yes.
So those conditions do explain that each person has different experiences, and for you to go, before you decide which family planning method you want to use, I think you have to visit the health facility. Upate advice after they've checked you, they've known your weight, they've known your health conditions. You get the right one for you.
Yes.
Yeah.
Yes.
Don't just assume that because someone uses the daily pills and they're okay, it's also okay with you.
Yeah, well, that is true. And unfortunately, for us women, we tend to talk and seek advice from each other when it comes to family planning. And you'll probably find a woman coming in at the facility, I do want Depo because somebody else is using Depo and it's working well for them. But that does not guarantee that it will work well with you, because probably you have an underlying condition they don't have. And then the side effects also vary. how that method will react on your body is not the same way it will react
To
on me.
someone else.
Yeah, so
Don't like, people should not make a choice out of someone else's experience.
exactly,
Yeah.
exactly. That's why when you come to the hospital, it is good to have a talk with your healthcare provider so that you're able to identify and know which options are available for you. We are not going to, make a decision for you,
Yeah.
but we are going to help you see what are the available options, and
Yeah,
then
you
with
can
that
do
you're
this
able
and
to
this.
make informed.
So yeah, you choose.
Yeah.
Okay. So okay, we've answered the factors to consider.
Mhm.
We've talked about them. So what are some of the barriers that people face when trying to access family planning?
First of all, I would say lack of information and also misinformation. Those are two things.
Yeah.
Lack of information in the sense that you really don't get to know about options that are available in that basket.
Yeah, you don't even know much about family
Yes.
planning.
Yes, I mean, right now we will talk to some women, they will tell you, I've never had anything to do
Yeah.
about the patch or
I don't know what it is.
exactly, or the hormonal ring, right?
Yeah.
Yeah, so you see, with that, it means we there's no enough information. You probably know some family planning up to a certain point because these are the common methods that we have available in our hospitals, in our communities. Yeah, and then misinformation as well, because just as I said earlier, you might find a woman is using a particular FP method, and then it reacted to them in a different way, and then this information they're carrying it to a friend, and you see with this, it's more of, in research we call it snowballing. It's like I'm recruiting you.
Yeah.
You already have that mindset.
Influence.
Exactly. And especially with how the world is right now,
People get influenced easily.
Very, very, very.
They assume that you're my friend, so whatever goes well with you, it will go well with me. Yeah. And that's so wrong. So what would you say about the long-acting reversible contraceptives? Is there a reason? First, what are they? And is there a reason to choose them over the other methods?
First of all, I would say I will not pick a method for you, but I'd want you to look at is this something you want? You see, there's a lot of considerations you have to put when you're going for a method, right?
Yeah.
I don't want to get pregnant in this certain period of time. I probably you see there's something that has to make you go for a particular method.
Yeah.
So for the long-acting methods, I think it will depend with how long we are talking of.
Yeah, how long?
But for the long-acting method, we do have the implant, the one rod that is usually put on the arm. It goes up to 3 years. We do have the Jadel. Jadel goes up to 5 years. We do have the IUCD. So the IUCD, we do have the hormonal one. So the hormonal one goes up to 5 years. And when we do have the copper T, which is commonly known in our community or our society, and that goes up to 12 years.
I've always known it's 10 years, so at least that's something I've corrected.
Exactly.
It's 12 years, not 10.
Yeah. And also, there's something else, just to point it out, when you're going to the health facility and you're looking for copper T, you also have to ensure, if you notice you react with metals, earrings, necklaces, you have to see your dermatologist just to see, is it that you're allergic to probably copper, because we don't want the adverse effects to come up because we inserted something you're allergic
to.
Yeah, so that is something I just wanted to point out. Yeah, in regards to copper T.
There are two, 12 and 5.
Yes.
I know about the 12 one.
That is the copper T.
Only.
And
I'm sure I'm not alone.
And it is non-hormonal.
I'm sure I'm not alone. I didn't know there is a hormonal option for 5 years.
Yes.
Yeah. I think that's something most people will also find out from this conversation. Are there any particular challenges that the marginalized communities face?
Yeah. For
when
the
trying to access family planning?
yes, yes. You see, with the marginalized communities, especially in the rural areas, um, we do have customs, and you find that their partner or their husband is the one who has a say
Yeah.
in everything. Also in medical approaches and just what to do medically. So you find some don't believe they want a use of FP, right?
Yeah.
And then also apart from that, there's also that misinformation in the sense that you have women talking back in the facility, hey, this did to me, and you see with this I'm sharing this information with you, you'll share it with somebody else, and as you continue that way, it would mean there's a lot of that misinformation.
Yeah.
And then also lack of information or education in regards to family planning options that are
which
available.
I think should be done more.
Yes,
so that more people are aware.
Yeah. I mean, you'll go to a hospital in a rural facility, and what they know as a family planning option that is available, it is the Depo Provera.
Yeah, only.
They do not know, we have these more options. And then I think also something else that creates a barrier is when we do have stockouts, and then you find only particular methods are available, and then the other ones are not available. So with that you're limited. So you wouldn't go for something that is not there. You want something that is there. So if you don't get that information, and if you don't get the commodities, you will not go for it, right?
So the only way to address this, especially in the rural areas, is to more of community outreach.
Yeah, we really need more of the community outreaches. Yeah, I know from the hospital they are doing their part. Also apart from the empowering the community health volunteers and the workers, so that they're able to bridge that gap, from the community to the hospital. Yeah. So that would go a long way.
More knowledge, provide more knowledge to those people. Do some of them at I believe that family planning husbands of those women in the rural areas mtu atake family planning because they just want more children, for status.
Yeah, unfortunately that is still a thing, where the man believes the wife got into the union to give birth to babies, and these babies to translate into wealth. But in the real sense, in the times that you're living, the times are hard. They're harsh economically, and I feel times have really changed, and they still have that notion. So,
but because they don't have the knowledge, they don't think it's necessary.
Yeah.
When your husband says, "I want another kid," they don't really care about the situation.
Yes,
you see, someone misled us. Mtoto anakuja na sahani yake. So people will say, family planning is not necessary. Mtoto atakuja na sahani.
Exactly, but the reality on the ground is, are you capable of taking care of that baby? I mean, si kila mtoto atakuja na sahani yake literally. Yes, they'll come with some sort of blessings, but are you
to some extent you have to work hard.
You have to work
to provide hard for that baby.
Apart from provision, you also have to ensure that you are okay physically, mentally, emotionally, in order to take care of another human being. So there's a lot to that.
You can't you can't bring forth a baby when you're not okay mentally.
Exactly.
You'll be frustrated, that's why we always see cases of people hurting their kids. Leaving their kids by the roadside.
Some cases of
something that
postpartum depression comes from, we were in this state where we were not okay mentally, and now, it creates more harm. So
something that can be easily addressed by family planning.
True.
Okay, is there an impact on family planning on maternal child health?
On maternal child health, yes, there is. I mean, as a woman, I've given birth today. I would love to birth space in order to give my body time to heal, to get me in the right space when I want to get pregnant again, right?
Yeah.
But as well, we are not having sex for procreation. We are equally having sex because it's a need, right? Right?
Yeah, it's a need.
Yeah, it's a need. So I don't want to keep on worrying as a woman that at the end of the day, if I'm not doing something, I'll get pregnant. And I'm not ready psychologically to take care of another baby. Yeah.
But do they affect, say I'm off a family planning method and I conceive? Is there a way my child's health is going to be affected before birth or even after birth?
Not really. The minute we learn that you're pregnant and you're already on, we gave you an FP method, it wouldn't really have an impact on that baby. Yeah.
And the 1% that gets pregnant when on family planning?
We've seen that case. We've seen those cases. I mean, like in oral contraceptives, pills, they are 99.7% effective in preventing pregnancy. While hormonal contraceptives are 98% effective in preventing pregnancy. Yes, you might fall in that 2% category. That's why you find we do have women who accidentally got pregnant while they were on a method.
Yeah.
So there's that possibility. Yeah. Just to reiterate that hormonal contraceptives are more than 98% effective, while we do have methods such as oral contraceptives that are 99.7% effective. So there's also that other percentage. Yeah.
Which can be so frustrating
when
you protected yourself from that unwanted pregnancy and you end up getting it.
True.
So are there medical conditions that do not allow family planning? You had talked of cancer. What else?
You see, with those, we usually have them fall in category 4 according to the medical eligibility criteria. So when you have current breast cancer, we are looking at conditions such as deep vein thrombosis, known as DVT. When you've undergone a major surgery, which has led to prolonged immobilization, you'll probably not go for a particular method, especially the hormonal method, totally. When you're looking at hepatocellular adenoma or malignancy, we would advise you not to go for it totally. And then apart from that, we also have ischemic heart diseases. We are also looking at severe hypertension. Yeah.
So the main reason is the hormonal imbalances,
Yes. And also looking at the side effects. So when you're not using them at all, it means that the conditions that present an acceptable health risk if the contraceptive method is used.
Yeah.
So that is why you do not use those methods at all costs.
Okay. Yeah. So I think this is going to be the last question. What would you advise the young people or an adolescent trying to get family planning or know about family planning?
I mean, do come for those services. We are available at the facility to serve you. And also something else, just to probably talk to our elders and parents. Please be open about FP methods. Our adolescents, they are sexually active. And, at times we are so harsh. They can't come to us and be like, hey, I'm using this method. What do you think I should do to prevent a pregnancy that I don't want, to keep at the end of the day?
Yeah.
So probably educating our elders more, as well as our guardians and our parents in regards to FP methods. And also as healthcare providers, when you come to us and you want a method, we will not deny you.
Yeah, right? Ladies, don't use the word women because the young ones, people start menstrual cycles early. People should be open.
Yeah.
True. Mostly this goes out to parents. Be open to your children, the girls, so that if they ever, I'm sure the reason schools don't teach family planning is because probably, say, high school kids would take advantage because they know, I won't get pregnant, I'll do this. won't get pregnant, I'll do this.
Mm-hmm.
But I still think it's a good idea if it's taught in schools.
Yeah, it is. I mean, we are living in we have a different generation.
Yeah. Whether we teach them
Right.
or not, they'll still find out.
They will still find a way.
And they'll find the wrong information.
Yeah.
Now that's the problem.
So if they have somebody who's guiding them, it's better for them to be, guided, so that they understand, okay, if you're not able to abstain, these are the available methods for you.
Yeah, so that they can even go for condoms in the hospitals without feeling fear ya stigmatization.
Yeah.
That someone will see me picking the condoms.
Yeah, that shouldn't be there. I mean, according to WHO, when we talk about women of reproductive age, we start from around age 14, 15 there, about to 49 years of age. So
reproductive age from 14, that's quite low.
Yes. Yeah.
Times have changed.
Yeah, times have changed. So that's according to categorization from the WHO. So we need to be open. I know this is something that we probably need to do more work on.
Yeah.
Even from healthcare providers, they usually feel some type of way from a parent perspective, and but we need to do more in terms of FP.
Thank you. That has been very educative. We've come to the end of this session on family planning. But if anyone has questions, you can comment your questions. Who knows? Maybe we'll get June to come back here.
For sure.
and answer more of them. Yeah.
I would love to come back and talk more, especially to our women, children, adolescents. Yeah. If you have any questions, just feel free. Yeah.
Don't listen to the misinformation out here, the rumors. Usiende unasoma under someone's post anasema vile alipata ball when they're on family planning, and maybe they got the method when already pregnant. Then inapea scare, people get scared from the negative experiences they read on others. So thank you very much.
You're welcome.
This is the end of this session. See you in the next episode.